the conventional treatment for breast cancer is to do some sort of surgical treatment to the breast, either to remove the cancer as a lumpectomy or in some cases even a total mastectomy. Part of the surgical treatment is also management of the lymph nodes, which conventionally is to remove all of the lymph nodes under the armpit area. Now, it turns out there are two significant problems with that sort of an approach. That is, removal of all the lymph nodes. One is it causes side effects. The arm can get swollen, there's an altered and decreased immune capacity, so infections of the arm can be worse. But the other issue is that probably about 2/3 to 3/4 of the women who have breast cancer don't even need this procedure done at all, because there's no cancer identifiable in the lymph nodes. So there's been a way developed called the sentinel node technique, which gets around this. And the way it works is the following way. On the day of surgery, a radioactive tracer is injected into the breast near the tumor. That gets absorbed into the lymphatic system and goes wherever the lymph duct flow takes it. When it gets to the first encountered lymph node, it gets accumulated, this tracer, and makes that lymph node slightly radioactive. And the surgeon, using a handheld detector, much like a Geiger counter, moving back and forth across the areas where this might be, get a feedback signal of the precise location of that first encountered lymph node. Then the surgeon simply does a biopsy by removing that 1 or 2 lymph nodes that are first encountered. And if those are negative for cancer, then in almost all cases, all the rest of the lymph nodes are negative for cancer as well. So in this way, through a simple lymph node biopsy, we can determine who does or does not need to have the remaining lymph nodes removed. And that's really, in a nutshell, what the sentinel node procedure is all about. This research first got kicked off using radioactive tracer in the early 1990s, and that was based on research other doctors had done using blue dyes to identify the draining lymph nodes, and that got applied to first malignant melanoma and then to breast cancer, and validated in breast cancer on a large number of women. And this was done in what was called a clinical trial, a randomized prospective clinical trial, where over 5,000 women were randomized to get either the conventional treatment, which is a removal of all the lymph nodes, or to have only the sentinel node procedure performed. That study has been completed, and we're now following along these two groups of women to determine the therapeutic value of just taking out a few nodes. We know it has less side effects. The real question is that as effective as removing all of the lymph nodes? In a way, it's very much like studies that were done many years ago that proved that a lumpectomy or a partial mastectomy was a safe and an effective procedure. So a group of women were randomized to either have what at the time was the conventional treatment, which is a mastectomy, or a partial mastectomy. We call that a lumpectomy now. So the sentinel node procedure is kind of the same thing, in that the conventional technique is a full total lymphadenectomy or removal of the lymph nodes, and the sentinel node is a partial, selective removal of just a few. And this has now been adopted for the most part across the United States, and much of the world is now moving into using this technique in Europe and in Asia, South America, Central America, as the preferred technique of managing lymph nodes in breast cancer.